Hey everybody, it's Dr. Eric Balkavage. We're back for another edition of the Thyroid Answers Podcast. We have another guest today. His name is Dr. Tom O'Brien. He's an internationally recognized speaker on food sensitivities, environmental toxins, immune issues. He's, it says the Sherlock Holmes of chronic diseases and holds a faculty teaching position at Institute of Functional Medicine and National University of Health Sciences. And he's the author of at least 2 books, You Can Fix Your Brain in the Autoimmune Fix. And we're going to get into some down and dirty discussion on the immune system, inflammation, autoimmunity, and talk about the things that are driving those processes. So Dr. Tom O'Brien, welcome to the Thyroid Answers Podcast.
Thank you, Dr. Eric. Pleasure to be with you.
Well, I appreciate you coming on. And we were talking offline, and for the listeners, it's a shame because we had a great discussion and we had to cut it and jump into this. But I'm going to have you do, I read that introduction that your team gave to me, and that's nice. But I think what we need is like an abbreviated version of what we just talked about. Like, who's Tom O'Brien, simply put, and why are you doing what you're doing?
Yeah, thanks. I had a consultant come in one day to our practice, and we spent a day with my team just talking about what's our focus, what's our emphasis here of trying to help people, and what is it that we really want to do. And what it came down to, bottom line, was making it easy to do the right thing. And to do the right thing with your health, to make it easy for you to understand and easy to implement, you got to know the basics of why you're in the space that you're in right now. Whether it's high blood pressure or attention deficit in your kid or whatever it should be, we have to understand, where's this coming from? Not just what pill do I take or what diet do I do to relieve the symptoms? And I'm so strong on that concept that sometimes you need to take a medication or a drug or a hormone, to function. Okay. But that's not where the problem is, but you have to function in life. So while you're looking for the trigger of this problem, maybe you need some help for a while. Okay, that's fine. But you don't just take the prescription, whether it's a pharmaceutical or a nutraceutical, and then keep living the same lifestyle that gave you what you've got, right?
Yeah.
So you've got to find out, where is it coming from? And what I've been looking at over the years, and I've read so many papers on this, and so we've put together this docuseries that's coming up soon called The Inflammation Equation. Because what I've learned, and no one argues with me on this, none of us have ever thought of it this way before, but there is no root cause to disease. There's lots of causes of why diseases come. There's lots of causes, but there's one root mechanism. The Center for Disease Control tells us that 14 of the 15 top causes of death are chronic inflammatory diseases. It's always inflammation, except for unintentional injuries and accident. Everything else is inflammation. Okay, so what's inflammation? Mrs. Patient, your immune system is the armed forces in your body. It's there to protect you. There's an Army, a Navy, an Air Force, a Marines, a Coast Guard. We call them IgA, IgG, IgE, IgM, cytokines. They're all different branches of the immune system there to protect you. So when the immune system gets activated and you've got extra inflammation, the question is, the million-dollar question, what's it trying to protect you from? And that's what we have to look at. Why is my immune system active right now? Inflammation's not bad for you. It saves our life every day. Excessive inflammation is bad for you. And so we have to look at, why do I have excessive inflammation? I'll give you one example and then I'll pause. But you ask, why am I doing this? Where does it come from? A 7-year-old patient diagnosed with celiac and failure to thrive, meaning wasn't growing, shortest kid in the class. And the parents had taken him to 3 top celiac centers in the world, 3 of them. And they were so squeaky clean, no gluten exposure. When they go on vacation, they take their own pots and pans and silverware, so there's no chance of any contamination. But he wasn't growing. And one of his blood markers for celiac, called transglutaminase, stayed really high. So they came to me to see me. And I said, okay, clearly you've got celiac disease. All right, that's obvious from the test results, but it's not releasing. So the question is, what's the emergency brake that stop you? You ever back out of a driveway and you say, what's wrong with this car? It's barely moving. It's moving, but the emergency brake. And you let go of the emergency brake, then you back up just fine. There had to be emergency brakes that were not allowing this boy's body to thrive. And he was avoiding squeaky clean, staying away from gluten. What did we find? We found it was 2 things. Mold metabolites in his body that were really high, activating that immune response, fighting mold, and a petroleum byproduct that was really high. He was fighting a petroleum byproduct. Well, where'd that come from? Well, the mold, the mother had her house checked professionally. There's no mold in the house. She had the school checked, the classroom, that it was no mold in the school. They couldn't figure out where it's coming from. Then she realized every week on a certain day, her son goes to grandma's house for an overnight. And they checked grandma's house. There it was, black mold in the wall of his bedroom. And so they remediated grandma's house. And for the petroleum byproducts, they're looking and looking and looking where it's coming from. Then they found it. It was the rubber bands on his braces. And so when they took the rubber bands, they got those braces off of there, and grandma's house got cleaned up. Within 6 months, he had grown 4 inches. So it's the emergency brakes. And of course, the inflammation all went down when he wasn't being exposed to the toxins anymore. And the markers for celiac went down, and now he starts to grow. So that's a classic example of where we think we knew where the cause of his problem was. No, we didn't. The cause mechanism, the inflammation was there. Okay, but why is the inflammation not coming down? Well, it's the immune system fighting something. What is it fighting? I don't know. Let's find out. So you have to do the test to find out.
Yeah. So I think for the listener, one of the things that I think is really important to just kind of summarize here, when we're talking about immune-driven disorders and inflammatory processes, I say this all the time on the podcast, that we typically operate in 1 of 2 modes. Our cells are either in low stress mode, a state we call homeostasis, where everything works pretty good, inflammation's fairly low, or our cells are operating from a danger perspective, a threat perspective. And when we have that situation going on, there's a natural downregulation of the metabolism of the cell and an upregulation of the cell defense mechanisms. This isn't broken physiology. This is adaptive physiology, but it doesn't make us always feel so good, but we need this type of response. And how this relates to those who are here listening to the podcast because of thyroid issues, this is my argument has been, and the literature backs that up, and I discussed this in the book, The Thyroid Debacle, is that your hypothyroid signs and symptoms, anytime you have a chronic inflammatory response going on, which is what Dr. Tom is talking about, you should expect to have hypothyroid signs and symptoms, because if there's an inflammatory threat on the cell, there's a natural decreased conversion of T4 to T3 to support what we call the cell danger or the cell stress response, which Dr. Tom, I'm sure, is very familiar with. If you didn't have decreased conversion of T4 to T3, you would have excessive oxidative stress in the cell that would create cell damage, apoptosis of the cells, and you'd be in worse shape. So it's a natural downregulation of the metabolism. And so why is what we're talking about important? Because it relates to everybody who's listening to this podcast who has a chronic health issue, who thinks they have a thyroid issue, who's taking medication, doesn't feel right on the dose that they're on. They're trying to find the magic mystical dose. It doesn't exist. And my argument has been, even with this community, that we have to stop trying to manipulate lab values and get to doing what we actually call ourselves as functional medicine practitioners, which is identifying the load that's driving the cell stress response. And as Dr. Tom said, it's often not the thing. every time. I don't go on social media too often, but when I do, somebody is saying parasites are the cause of autoimmune disease, or this one thing is the cause of autoimmune disease. And my argument is maybe, but more often it's the load. So I want you to talk about, if you agree with that premise, it's not the thing, it's the load. What's the load of stressors we're putting onto the cellular system that's pushing us from homeostatic regulation to allostatic regulation and kind of keeping us in that mode and driving this chronic immune inflammatory process. Do you agree with the premise that I laid out? And if so, what do you see are the big drivers of that excessive load?
Yes, I agree with you completely. I had the privilege of interviewing Dr. Alan Ebringer at King's College in London for the previous event I did 7 years ago called Betrayal, the Autoimmune Disease Solution They're Not Telling You. It was Dr. Ebringer, and when I interviewed him, I told him this. I said, Dr. Ebringer, I heard of you 30-some years ago or 40 years ago, and he looked at me, and I said, it was my first semester in my education, and it was my genetics class. And the professor came in with a research article, and he was so excited. This graduate student named Alan Ebringer in England had just published on the association of the bacteria Klebsiella pneumoniae and the development of rheumatoid arthritis. Mm-hmm. And he introduced the concept of molecular mimicry in my genetics class. This was my first semester in school. So I remembered your name, Dr. Ebringer, and he smiled and said, thank you. He was a very kind man, an elder man at the time. He's passed since. But the concept, I've really cut my teeth in this world on wheat-related disorders. I've been on the circuit for many years, lecturing at medical conferences all over the world about the dangers of wheat. And what the big problem with wheat is that when your immune system, here's how I'll say it. Mrs. Patient, you have sentries standing guard just inside the first part of the small intestine. I think of the soldiers at Buckingham Palace, those big hats, and they're standing as stiff as can be. They don't move, they're dormant, they don't move at all, but don't mess with those guys. We have immune cells in the first part of our intestine that watch everything that's coming out of the stomach into the intestine. They're called toll-like receptors, but their job is to watch, to see, are there any bugs? Are there any bacteria? Anything of danger that's coming out? Why? Because you have the same body as your ancestor thousands of years ago. You got the same kidneys, the same muscles, the same bone structure, the same immune system. We use our brains more, so we've got housing and we've got food year round. But our ancestors were nomads. They followed the herds. This was before agriculture. And their top priority was finding food. They'd find something, they'd pick it up, they'd smell it, they'd nibble at it, and then they'd eat it. Well, sometimes what they'd pick up and eat, they couldn't identify was bad for them. It had bad bugs. And so if they didn't have these sentries standing guard, so anything that comes out of the stomach, they kill it right away. They do two things. They activate what's called leaky gut, so that water comes from inside the body into the intestines to wash out the bug with the poop. That's why we get leaky gut. And they activate the major amplifier of inflammation called NF-kappa B to kill the thing, this bad bug. It saved our lives. And those ancestors that didn't have good defense mechanisms, they died from the bad bug. And they did not reproduce. Those that had good defense mechanisms, they reproduced. And that's the genes that have been passed down for 10,000 years to us today, to humans today. We've got this same defense mechanism that's watching everything that comes out of the stomach into the first part of the small intestine. Okay, that's a basic physiology. Next point. Dr. Alessio Fasano, professor of medicine, Harvard Medical School, professor of nutrition, Harvard School of Public Health, the chief of pediatric gastroenterology at Mass General at Harvard, the director of the Celiac Research Center at Harvard, the director of mucosal immunology, that's the lining of the lungs, the lining of the gut, the lining of the brain at Harvard. He's got 5 titles. Any one title is a lifelong dream for someone at the top of their game. He's got 5. We think he's going to win the Nobel Prize because it was him and his team that identified this thing called leaky gut and how it happens way back in 1997. And the production of this protein zonulin that opens up the leaky gut. He's very, very careful about what he says, always, so he's not misquoted. And you'll see there's 400, 450 articles that Fasano is a part of, and you'll see 8 people on that article, and then the last one, Alessio Fasano, the stamp of approval from the boss, right? This article, he wrote himself, all by himself. And this is what they're teaching at Harvard Medical School right now. The title of the article says it all. All disease begins in the, quote, leaky gut. The role of the protein zonulin in the development of chronic inflammatory disease. Now remember, 14 of the 15 top causes of death are chronic inflammatory diseases. Mm-hmm. All disease begins in the leaky gut. In that article, Fasano describes the sentry standing guard to protect us. It's a life-saving mechanism we've inherited from our ancestors. And here's the problem. The way that the sentries recognize the bad bug is that they look at the amino acid structure of that piece of the bad bug. Okay? Mm-hmm. The problem here is that gluten has a very similar amino acid structure to the outside shell of a bad bug. Gluten is misinterpreted as a harmful component of a bug, and it activates leaky gut in every human that eats it. And it activates inflammation in every human that eats it, whether you feel it or not. This happens in every, and this is what they're teaching at Harvard Medical School, which is so great. So in 10 years, it'll be common knowledge in every medical office. At this point, it's still not that common a knowledge. But that's my point here, is that the trigger, that's why the first thing we do with most every patient until the test results come back, Mrs. Patient, let's put you gluten-free, dairy-free, added sugar-free, increase water to 1/3 of an ounce per pound body weight, and let's see how you do until your test results come back. And what we see so often is that people come back and they're already feeling better because they've reduced their inflammation. They've already started to reduce inflammation because wheat is a very common gasoline on the fire. Dairy is a very common gasoline on the fire.
So wheat is a potential driver of the chronic inflammation in the body. There's also the discussion or the thought process that the very thing we spray on the wheat as part of, and on many crops, as part of our normal farming processes, may be problematic as well. That something called glyphosate is essentially an antibiotic that disrupts the Shikimate pathway. We don't have a Shikimate pathway, but our gut flora have a Shikimate pathway. And there's a discussion that, is it wheat? Is it the glyphosate? Is it both? Is it part of the load?
Yeah, that question is just from people who haven't had a chance to read enough of the science. The glyphosate makes it worse. There's absolutely no question it makes it worse. Absolutely. But there's been a 5-fold increase in celiac disease since 1950. 5-fold, that's 500%. Glyphosate just came out in the 1990s. And the rate of expansion is the same. It's 4 to 9% a year. It's going up. But it's been that way since the 1960s, 1970s, 1980s. So it's not the glyphosate that's causing the problem. There's no question glyphosate makes it worse, but that's not the primary problem. The primary problem is the amino acid structure of the proteins in wheat. They look like the amino acid structures of a microorganism, and you cannot fool your immune system. Your immune system's going to fight it every time.
So for thousands of years, we've been eating bread, right?
Right, right.
So is really wheat and the peptide structure the problem, or is it that how we make bread in the old process was bacterial fermentation, right? And the bacteria, the fermenting process actually broke down the peptides in the wheat. And so when we ate old style bread, not commercially available bread today, or the yeast starters that we buy at the grocery store today, we are eating a product that still has a lot of peptide structure in it. And it's those peptides that are still circulating on top of low stomach acid, reduced digestive enzyme output, that are then resulting in more reactivity or cross-reactivity with the peptide structure of some of these bad bugs?
That's a really good question. As I said before we started the recording, it'd be great to sit down with a bottle of wine with you and just geek out together, because it would be a lot of fun. So the answer to that question is there's only one study that has ever shown that a fermentation process eliminates any negative immune response to the ingestion of wheat. Only one study. Now, there are many studies that show it reducing, but not eliminating. And that one study that did eliminate completely, they used 7 different strains of Lactobacillus san franciscus. And it's a strain for sourdough. But they use 7 different strains. And that comprehensive overview broke down the proteins enough that it did not activate the toll-like receptors trying to protect you from a bug. So it broke down the food particles enough to where people could eat it. But it's not commercially possible to make that kind of bread with the 7 strains. But that's the only study that I've ever seen, and I haven't read every study, but I've read a lot. But that one showed me, and it changed my opinion, because I thought it was just impossible. But when I read that study, and it was a well-done study, I said, oh, okay, can't argue with the results here. Okay, it is possible to eat wheat again. And I'm looking forward to the day. I just haven't put any time into it yet. You know, I was a baker in my 20s. Me, of all people, you know, I'm known as the gluten guy out there, because I've been talking about this for many years. But I was a baker in my early 20s in my undergrad years. And I'd look forward to making bread again using 7 different strains of Lactobacillus san franciscus. And I hope to do that someday, and then we'll try it. So, but that's the only study that I've ever seen where it was safe to still eat wheat.
Yeah. So we've got wheat as a potential problem that might be triggering intestinal permeability and chronic inflammation. Is there anything else that you typically see driving that inflammatory process?
Oh, yes. My goodness, yes. And that's what our event is about, that's the environmental triggers. So in that article by Fasano, it'd be good to spend a little bit of time on this article, because it's just game-changing. When you read it, you're just thinking about it often. He identifies the perfect storm in the development of chronic inflammatory diseases. 14 of the 15 top causes of death are chronic inflammatory diseases. Fasano talks about the perfect storm. That includes, there's 5 steps in the perfect storm. The first is genetics. Can't do anything about your genes. That's the deck of cards you were dealt. However, and some docs said, well, we're going to turn off those genes. You can't turn off genes. Genes operate on dimmer switches, and you can dim the gene down so it doesn't express itself, or you can ramp a gene up so it really expresses itself, but you can't turn them on and off. So the first in the perfect storm is your genetic vulnerability to rheumatoid or to Hashimoto's or to whatever your disease might be. There's a genetic vulnerability. Number two of the perfect storm is the environmental triggers that activate or calm down the genes. The fingers on the knob of the dimmer switch are environmental triggers. You live in a moldy house, you've got brain inflammation, guaranteed, every single time, because you're breathing mold straight up to the memory center of your brain every day, 24/7. So that's an environmental trigger. If you have lead toxicity or mercury toxicity, that's an internal environmental trigger, activating your immune system trying to protect you. But the most common source of environmental triggers is what's on the end of your fork. That's most common. What we eat activates our genes to either ramp them up or calm them down. Number three, the way that happens is that when you have too many inflammatory triggers, environmental triggers, you change the balance in your gut of the good guys and the bad guys. The geek term is dysbiosis, which means too many bad guys, not enough good guys. That's number three in the perfect storm. When you develop dysbiosis, anyone with bloating or gas, abdominal cramps or pain, constipation or diarrhea, you've got dysbiosis. And it can be at many different levels, but there's an imbalance in the good guys and the bad guys in your gut. That's number three. Number four, Mrs. Patient, your digestive tract is a tube. It goes from your mouth to the other end. One big long tube, 20, 25 feet long, winds around in the center. The inside of the tube is lined with cheesecloth. Why? When you take a bite of a hamburger and you chew it 3 or 4 times and gulp down that glob of meat, we should chew 20 times, 15, 20 times, most of us don't. But when you gulp down that glob of meat, that can't get into your bloodstream. It stays in the tube, and it has to go down further in the tube to be digested or broken down. Think of a pearl necklace. The acid in your stomach undoes the clasp of a pearl necklace. Now you have a string of pearls, and your enzymes act as scissors to cut that pearl necklace smaller and snip, 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 until you're down to each pearl of the pearl necklace we call an amino acid. When it gets down to the pearls of the pearl necklace, those pearls slip right through the cheesecloth into the bloodstream. That's called absorption. That's how we absorb our nutrients. That's normal. It's how it's supposed to happen. And that's why your gut's 20, 25 feet long, is because it takes a whole lot longer to break down prime rib than it does a banana. So you have to snip, 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 snip to get it down, and then it gets absorbed. But when you have dysbiosis, number three of the perfect storm, too many bad guys, not enough good guys, it creates an environment inside your gut of inflammation. And when you have this inflammation in your gut, you tear the cheesecloth. When you tear the cheesecloth, bigger clumps of the molecules of the food get into your bloodstream before they're supposed to. Those are called macromolecules. So when you tear the cheesecloth, that's called leaky gut, intestinal permeability. You tear the cheesecloth, and these bigger macromolecules get into the bloodstream through the tears in the cheesecloth. Now they're in the bloodstream, and poof, they're off to the races. Your bloodstream's just a highway. Lots of traffic all go in the same direction, but it's just a highway. But now you've got these macromolecules of food that got into the bloodstream before they were supposed to. That's number four in the perfect storm, which then activates your immune system to fight that macromolecule, and you make antibodies to fight that macromolecule. That's number five, chronic systemic inflammation. 14 of the 15 top causes of death are chronic inflammatory diseases. And this is the perfect storm in the development of autoimmune diseases. That's why Fasano, who we think will win a Nobel Prize, wrote the paper by himself, All Disease Begins in the Leaky Gut. And this is PhD material. When you really dive into this one, you read that paper, and for me, I tape the paper on the ceiling of the front page of the paper on the ceiling of my bedroom. And when I go to sleep at night, I go, oh yeah, that's right. And then sometimes at night I'll wake up thinking about it, or I'm driving down the road and I just think about it. I give myself permission to daydream on a topic. And then, oh, I understand how that works. Wow, that's very, very cool. Wow, the body was really cool. But that's the development of chronic inflammatory diseases. And that's what they're teaching at Harvard right now.
I think it's great. It'll be interesting to see how that translates into allopathic practice later on in time, but I'm
Yes.
glad to see it's being taught. I mean, I think
Agreed.
for the patient's perspective, I think we have to do a better job of building a bridge between allopathic and functional medicine and to the patient's benefit. One's not better, they do different things, but it's nice to see that some of the things that maybe we've been talking about in functional medicine for 20 some years are now starting to get it taught in allopathic medicine. So I think that's great. But let's get back to inflammation now. We've got all that information. So we know that permeability leads to inflammatory processes. What are some of the key factors that may lead? There has to be more than food that leads to permeability issues. What are some of the top things that somebody might consider might be driving a chronic immune inflammatory process in them and maybe contributing to the permeability issues?
That's really a great question. And that's the $1 million line of thinking, that our goal is that everyone understands as a result of our event, because I traveled the world and I interviewed the greats on these topics. When you ask David Furman from Stanford, who runs his department at the Buck Institute, he's got the contracts with NASA to figure out why are the astronauts aging so quickly in space, because it's serious. It's really serious. There's no way astronauts can go to Mars. The technical equipment to go to Mars is almost there, apparently. It won't be long at all. But humans can't make the 2.5-year trip to Mars. They die of old age. So Furman's team has been studying this for quite a while. And he looked at where in the heck is this coming from? And what they found is that it's always inflammation. Without exception, it's always inflammation. And they came up with the term inflammaging, which is the aging process is because of inflammation. And the more inflammation you have, the faster you age. So he did a diagram in one of his research papers to explain this basic 101 concept that no one thinks about, and I saw this diagram and I said, I've got to do this. I've got to do this event and get this message out to the world, because this will change people's lives when they understand this diagram and they begin applying some rational common sense questions based on the diagram. And we're giving the diagram to everyone, who attends the event. So imagine you've got 3 gears connected to each other in a straight line, and the teeth are intersected. So when the gear on one side turns, it automatically turns the next gear, which then turns the 3rd gear. The gear on the left, the teeth of the gear on your left are your lifestyle, your environment. And the way Furman categorized them was chronic infections like bacteria, viruses, bugs, things like that, physical inactivity, obesity, dysbiosis, which means too many bad guys, not enough good guys in the gut, food selections, excessive chronic stress and what those stress hormones do to your body. Not replenishing sleep, disturbed sleep, and xenobiotics, the chemicals that accumulate in our body, the heavy metals, the petroleum products, all of that. Those are the teeth on the gear on the left. So when you have too much of one of those, imagine the gear is turning, which now turns the gear in the center, which is chronic systemic inflammation. Your immune system trying to protect you from whatever if you're eating French fries every day, these bad fats, you're eating French fries, then that's activating an immune response. You're not getting good sleep, that's activating an immune response. Whatever the triggers are, the environmental triggers, they're on the left gear. That turns the gear in the middle, which is systemic chronic inflammation, which then turns the gear on the right, which is type 2 diabetes, autoimmune diseases, cardiovascular disease, cancer, depression, neurodegenerative diseases, osteoporosis, immunosenescence. It doesn't matter what the disease is on the right. It's the mechanism on the left of too much of something or not enough of something that's turning the gear, causing the inflammation that manifests. And where does it manifest on the right side? Mrs. Patient, you pull at a chain, it always breaks at the weakest link. At one end, the middle, the other end, your heart, your brain, your liver, your kidneys. It just depends on where your weak link is. The pull on the chain is inflammation. That is the root cause mechanism of chronic degenerative diseases. Your immune system trying to protect you from something, and what we have to do is find out what's it trying to protect you from. So that is the message of the inflammation equation. And we've interviewed David Furman, Yehuda Schoenfeld in Tel Aviv, Israel, Jeff Bland, the father of functional medicine, Joe Pizzorno, the father of naturopathy. The list goes on and on. Bruce Lipton. The list goes on and on of the experts that we've interviewed on this topic about each of the teeth on the left side, whether it's infections or obesity or dysbiosis or diet or chronic stress. You know, it was startling when Jeff Bland told us, and I don't know if you know Dr. Bland, but he doesn't exaggerate. He's right on the money with science all the time. And he said, you know, Tom, when you have a negative thought, you activate the immune system trying to protect you just as powerfully as if you're exposed to a SARS-CoV-2 virus from a negative thought, which means if we have continual stimuli in our lives of negative response to something, you got to deal with it.
Yeah, I think that for a lot of people, after doing this for 28 years, that what I call emotional fitness is probably one of the bigger influences on what's driving chronic inflammation and chronic illness and chronic stress response.
I agree. And you know how hard it is. This is a really important concept. You know, I told you before we started recording that I just got off an interview yesterday with a woman that I interviewed for Betrayal, the autoimmune disease event we did in 2016. And at that time, she had just put her multiple sclerosis into complete remission. Mm-hmm. And in the interview, she said, you know, I took the tube here. That's the train in London. I took the tube for this interview today, and I walked the 7 blocks from the station to this hotel. And it's not a big deal. But then she tears up and says, but it is. And then we show you the picture of her in a wheelchair. 2 years earlier, she couldn't walk. And she had 8 lesions on her brain. And here she was today, no symptoms whatsoever, and only 2 lesions left on her brain. Mm-hmm. So that was in 2016. That was 8 years ago. So I wanted to interview her for this event and say, how are you doing? did it come back, or how are you? And she is vibrant and healthy and mountain bikes. And I asked her the question, and this was profound. This making it easy to do the right thing means if you understand what the path is, then it's easier. If you don't understand, then you're flailing all over the place. I asked her, her name was Elmira. Elmira, what does it take to put your autoimmune disease into full remission? What did it take? How did you do it to be successful? And without thinking, she said immediately, the day my son was diagnosed at 16 with multiple sclerosis was the day I decided whatever it takes. And she had met a functional medicine practitioner, a friend of mine in London, and she said, I'll do whatever he says without exception, whatever it takes. And so I smiled, I said, so it's really a mother's love and a mother's protection that got you well. And she said, yes, it was, because I'm not sure I would have done it by myself, because it was really hard at first. But as soon as I knew this was my son's life, then there was no question about it. So the emotional side, the chronic stress that we're under is such a big component. She said that she was a child. She was an ACE child. And I said, what's that? Adverse childhood events. And so I decided to probe a little bit. So does that mean that there was some trauma that occurred or something? And she said, my mother died at 3, when I was 3. My father died when I was 9. And my stepmother died when I was 11. And I went through 7 foster homes in the next 5 or 6 years. And that's what she referred to as an adverse chronic event. And then she talked about her relationship with her husband, that within a year of starting to feel better, she realized that she had to get a divorce because the relationship with her husband was very toxic. And she said, he's not a toxic man. He's a wonderful man, but it was a toxic relationship. So when she realized that, and then she said, and that was back in 2016 or 2017 when she got the divorce, and she said yesterday, I'm ready now to begin dealing with the emotional trauma of my childhood. So what she had to do first was stop the input, the constant stress, emotional stress, producing the stress hormones for her to get well. So I'm in full agreement with you, Dr. Eric, and I think the most difficult thing for people is to deal with the emotional stress. Most difficult.
Yeah, I think the challenge is sometimes we blame the things that happen. And I don't discount that. But it's really more, in my opinion, about how we perceive those things that happen to us. Tony Robbins says false emotions appearing real. I don't think that's right. I think they're real emotions. Now, we're all we have all had our story, right? Everybody's got their trauma, their story. What often differentiates whether somebody is made chronically ill by that or not is how they interpret it. Everybody can have their pity party, but is it become part of the load, or do they use that stress, that trauma to grow, right? To develop, to become stronger. So we can be problem focused or solution focused. We can carry those traumas along with us in a rucksack for the rest of our life, and that adds to our load. And sometimes we don't even realize we have those emotional burdens in the conscious or subconscious mind. But for a lot of people, when they've been to 7 functional medicine practitioners, 2 or 3 or 4 different of every specialist, to me, at the end of the day, I go back to what's going on between the 6 inches of their ears that they either realize or don't realize that's driving that chronic stress response, winding up that limbic system and keeping them in that fight or flight response. And some of the Bruce Lipton was one of the first people like I really heard in chiropractic school. And I was like, man, this this guy's like in chiropractic school, we have this philosophy: physical stress, chemical stress, emotional stress, right? All of these things. But when I listened to Bruce Lipton, I was like, man, what goes on in the mind does play a massive role as to what the outcome is. We can change our gut biome. We can change the acids and the enzymes and we produce. And then when you see the work of people like Joe Dispenza, who are actually measuring after working with people from an emotional standpoint and mindset standpoint, changes in gut biome from the start of a week to the end of the week, changes in blood chemistry from the start of the week to the end of the week, you really realize how important what goes on between the 6 inches of your ears has on your ability to get well and be well. You can't I don't think it's as simple as you just wish yourself or think yourself healthy and it's going to get there. There's a lot of pieces to the puzzle, but I think for the people to start the journey to get well and be well and stay at a higher state of health, you've got to have really strong emotional fitness.
I agree completely with everything you've said. And this interview yesterday with Elmira was jaw-dropping for me because she represents, first, it was the mother's love that overrode everything, irrespective of what her emotions were, what her feelings were. She knew she was told what she had to do, and she did it. And she put her and her son's MS into complete remission. Now we are 8 years later, and she said in the interview, I think I'm ready now to deal with those childhood traumas. This is 8 years later. And I'm bringing that up so that people don't think you're supposed to be able to turn it around in a weekend or in a week, First is awareness. First, you just need to be aware. Wow, there's a lot going on here. Making it easy to do the right thing doesn't mean it's easy to do it, but here's the path. Here's the path to go down to put your dis-ease or your disease into remission. This is how you do it. And as in my interview with Fran Drescher, I'm sitting with Fran there, and she says, Dr. Tom, how do you get to my guest bathroom? Because we were in Fran's house, and I just come from the guest bathroom before we began the recording. And I said, well, it's right over there. And she said, yes, but how do you get there? And I saw the sparkle in her eye, and I knew what she was doing. And I said, one step at a time. Exactly. And then she gave that laugh of hers, that nanny laugh, that we need to be kind to ourselves. There's a word when I went through a divorce 20 some years ago, I felt terrible. I felt that I wasn't a good person because I was breaking up my family and I just wasn't happy. I just didn't. And I was in a store one day and I saw a book that just called to me. It was called When Things Fall Apart. And I grabbed the book. It was by a woman named Pema Chodron. And when I read the book, there was a word in there that just resonated for me. And I'm not sure I pronounce it correctly. It's a Tibetan word, but I pronounce it Maitri, M-A-I-T-R-I. And it means loving kindness and an unconditional friendship with oneself. You need to be your own best friend and lighten up on yourself. Don't expect yourself to be perfect. Just put one step in front of the other. Just do one thing at a time, one step at a time, and you'll get there. You'll get there. And, that was Fran's message, because she talks about how critically important it is to make your home your sanctuary, your temple. It needs to be the cleanest place on the planet so that your body can heal. And, she talks about a bunch of tips that she does. And we have that as the gift for everyone when they register for the event before the event begins. And just the idea of reducing some of those exposures on the teeth of those gears on the left side, the teeth of your environment, just reducing some of those. Critically important. But to your point of what you were saying, I think the mindset is most important, and we need to lighten up about how quickly we're supposed to get over our childhood stuff. You know, Elmira was saying, I think I'm ready now to really deal with this.
Yeah.
And find some.
I think for everybody, this whole health thing is a journey. We talk about, we usually throw the term around health and optimal health. I don't know that we even have a great definition of what that actually means. So I think for everybody, the focus is, I don't know, we know what health is. As soon as you think you're healthy, if you do more things, you feel better, and you go, oh, maybe it's beyond that. So it's really a journey, and the focus should be on having lots of raising, as I say in my book, The Thyroid Debacle, raising your level of fitness in all these, what we call fitness factors: nutritional health, or dietary health, sleep health, respiratory health. So you have to just keep raising your level of fitness in all these different categories, and that's how you wind up getting healthy. There's no magic supplement, there's no magic pill, and there's no one thing that's usually creating the problem. But if we're talking, for listeners who are listening to this, we've told them that there's a load of things from our environment that create an excessive level of stress on the system that triggers inflammation. And then that leads to what I call a multi-system adaptive disorder. And that means that, people like, well, do I have an adrenal problem? Do I have a thyroid problem? Do I have a gut? Like, what? I'm like, you have a multi-system adaptive disorder, meaning that when there's a stress response, all systems are downregulated to degree. Sex hormones are downregulated. Yet elimination, detoxification, because the primary function is this fight or flight inflammatory cell defense mechanism. So for the listener, you should expect to have a blood sugar problem. You should expect to have a thyroid problem. You should expect to have a sleep problem, an anxiety, a depression, or neurologic. These are adaptive responses when we're under stress. You're not stopping to eat. You're not stopping to have sex. You're not stopping to have a deep sleep. You should be alert and active and in defense mode. So we see people have multiple conditions and disorders, usually not just one. But for the person who's listening to this, and I say raise their level of fitness, step one becomes recognition that they have a chronic inflammatory response. The big challenge is, especially in I'm not bashing allopathic medicine, but we don't measure inflammatory markers on people on a regular basis. So
That's right.
For the person who's listening to this saying, well, maybe I have a chronic inflammatory condition as well, what tests, if they're not seeing a functional practitioner, or maybe if they are, what have you seen are some of like the best tests, the gold standards for assessing inflammation in the body?
Yeah, good question. Thank you. I don't work with many people one-on-one anymore. I'll do one every 2 weeks or so. They have to get through my staff first, and if I'm going to see them, I want to see the last 5 years of test results, and they have a 30-page questionnaire they have to fill out first, and then they have to do 4 tests before I see them. And so that my time with them is most beneficial for them. And those 4 tests include the wheat zoomer, because you zoom in on the problem, the wheat zoomer. It's the most comprehensive test in the Western world. I've not gone to China or Japan or Thailand, the Far East, to teach, so I don't know what their labs are there, but in Europe, in South America, Latin America, North America, this is the most comprehensive test available. It looks at 26 peptides of wheat, and it includes the most comprehensive testing for leaky gut within the wheat zoomer in that test, the wheat zoomer. That's the first test. The second test is the neural zoomer plus. not the NeuroZoomer, the NeuroZoomer Plus, because it looks at 53 markers of inflammation in the brain. Now, to give you a sense of why that's important, Blue Cross Blue Shield published in February of 2020. No one talked about this. Not one newspaper listed this, because that's when the virus came out and everybody was focused on the virus. But they said, we've got a real problem here. In the previous 4-year period, there was a 407% increase in the diagnosis of Alzheimer's in 30 to 44-year-olds. 407% in 30 to 44-year-olds in 4 years.
Mm-hmm.
That we all are inflamed and it's affecting our brain. So we always do that test on our patients so that they, what? When they see that, that scares the hell out of them, which good. You need to wake up of the amount of inflammation that's in your body and how it's damaging your brain right now. The third test that we do is the gut zoomer, to look at your microbiome, the good guys that are there, the bad guys that are there. And the fourth test is called the total tox burden, to look at, do you have any mold metabolites in your system? Do you have any heavy metals in your system? Do you have volatile organic compounds in your system, petroleum products? Every newborn child today, when they check the umbilical cord blood, the average is 186 chemicals in the umbilical cord blood that aren't supposed to be there because moms are so toxic. So those are the 4 tests that we begin with. They give us a good overview of where to begin with the patient.
And so when you're looking at the 53 markers of brain inflammation, are these all things that, these aren't tests that are, these are direct tests, they're antibody tests, combination of those things?
Correct.
Are these things that the average person's not going to see these tests on their LabCorp or Quest, or are they going to see these same types of tests on the standard test?
No, they're not. You know, Mayo Clinic published on this in January of 2016. You know, as I said, I've been traveling and teaching all over the world for many, many years about the problems of wheat. And one of the big problems was the tests are always so inaccurate. They're not comprehensive enough. Until this test came out, and Mayo Clinic wrote a paper on it, calling it a new era in laboratory medicine, because they're using technology. And the way that I explained it on stage, you know, if I were to tell you back in 1990, you know, in like 25 years or so, something like that, I'm going to have this little black thing the size of my wallet. And, you know, if I just push on it a couple times and I move my thumb across it, I'm scrolling, I can tell you within a few seconds that the air particulate matter today in Chicago is 56. That's yellow zone. That means you shouldn't really be outside exercising. San Diego today is 36. That's pretty good. San Antonio, though, is 84. Do not exercise in San Antonio today. I can tell you that within 5 seconds because I went to an app called Air Matters. I've got the Encyclopedia Britannica in my hand, and I can tell you most anything I want to know within a few seconds, right? If I had told you that in 1990, you would have thought I was watching too much Star Trek and that I was a little bit of a nutcase. That's not possible. That's really not possible. The same, science improves. The same thing has happened in laboratory medicine. And most of the laboratories, most of the hospitals are using technology from 1990, 2000, maybe 2005. It's okay, but it's not cutting edge for the standard tests that are done, not specific focus tests, but the standard screening tests. That technology is from, some of it's from the 1960s and the 1970s. So these tests are cutting edge. And I've got 5 different papers from Mayo Clinic talking about this and how it just changed the face of medicine. Because now you can test rather inexpensively for so many factors that you couldn't do in the past.
So somebody might ask, I get the neural zoomer done with 53 potential inflammatory markers on it. Why don't I just take a bunch of anti-inflammatories? Why, if you're telling me all chronic disease is caused by chronic inflammation, why don't I just take a bunch of omega-3s and vitamin D and whatever else is anti-inflammatory or antioxidant? I'll just take lots of glutathione. Why not do that?
If I use less gas by driving 30 miles an hour instead of 60 miles an hour on the freeway, why do I have to get off to get more gas? I'm just using less gas all the time. You're going to run out of gas. You don't have a deficiency of anti-inflammatories. That's not the problem. And every scientist we interview talks about that in one way or another, that inflammation is a natural, healthy response of your body protecting you from something. It can be excessive, and we need to calm it down. You may need anti-inflammatories for a short period of time. That's possible, but that's not the problem. You know, if you have to function, you take the medication, but eliminate the triggers of the inflammation.
Yeah. Well, I agree with you. I'm just throwing out the devil's advocate because we do see that people are like, hey, just take glutathione every day, right? That'll help you. And while I think from a short-term benefit, taking some glutathione may be beneficial for a short period of time, there's another problem with that, right? You start loading the body with a whole bunch of glutathione that then goes from a reduced form to an oxidized form. Now you have to deal with the oxidized glutathione. And now you need resources to deal with it. And now you've got that oxidized glutathione is now one of the free radicals. So now it creates an issue. So I agree there, but that's been the model is, let's just take anti-inflammatories. Let's just take antioxidants and I don't have to change anything. So for the listener, I think this is really important, is what we're saying is if you want to understand that, do I have an inflammatory process? Step one, you have to run some types of anti-inflammatory tests. He's talking about some. You don't see as many clients, but there's some general inflammatory tests on labs. How do you see some of those things correlate as you run maybe a more comprehensive panel here? High sensitivity CRP, homocysteine, ferritin, uric acid, low bilirubin. Like, how do you see some of those markers? If somebody's like, my doctor's not going to run a gut zoomer, is there something on a general chemistry panel that I can look at to confirm I have maybe an inflammatory process?
Yeah, of course. And most people will have some of those positive. Of course they will. But they're high up on the scale. They're much higher level of inflammation. It's not the low grade. What we're talking about is the low grade chronic inflammation that's been there for years. A homocysteine that is at 10 is elevated. Anything above 8 causes endothelial inflammation. But the labs say up to 15 is okay, because it doesn't directly cause a disease that they can identify, right? So you can use the larger scale inflammatory markers in the stool tests. You look for elastase, eosinophil X. There's lots of tests that you can do, but we're going to talk about the tests that will show us the low grade. How do you test for them? What do they mean? Who's the inventor of the test in a couple of cases? What do you do about all this? I mean, there's so much to learn. It's a bit overwhelming at first. That's why we're taking 9 days to do this, 1 hour a day. And people can find out more about this. They can go to theinflammationequation.com/Eric, ERIC, theinflammationequation.com/Eric. And when you register, there's the interview with Fran Drescher for you right now. And you'll laugh and you'll tear up a little bit. But it's thought-provoking, creating your home to be your own sacred temple, because your body and your home are where you rest. You have to have a place where you feel safe. And she told us the story. You know, Fran is the president of the Screen Actors Guild. She was in charge of the strike. And because I asked her, I said, so Fran, how did you deal with these $1,000 an hour attorneys for the movie industry that I'm assuming can be just nasty people? She said, oh, I could tell you, with that accent of hers. But then she said, I took care of myself. I would only talk to them on Facebook, in my bathroom, on my chaise lounge, in my nightrobe with my tea. That's how Fran did the negotiations for the Screen Actors Guild. She created an environment where she had all of her safe environment around her and her tea, but she won. They won. The movie studios cannot use AI to write scripts for television shows or movies. That's what they were fighting for, to protect their jobs. So you'll hear stories like that, and you'll hear Fran just talk about how critically important it is, especially when you're under stress, like that was for her, to really take care of yourself.
Well, I think we'll get close to wrapping this up. I think the general theme here for the listener, and I would have loved to get in a little bit more depth on some of the toxins that people might be aware of, but I think we got a general gist that a lot of stuff in the environment can create a stress load on our physiology. It's hard to be perfect. It's hard to eliminate all those things, but the focus for most of us should be, how do I reduce the load as much as possible and essentially raise your level of physical fitness, emotional fitness, sleep fitness, respiratory fitness, dietary fitness. As you raise the level of fitness in these categories and reduce the things that are creating more of a negative stress load on your physiology, that's how you're going to come out of your chronic illness, recover from your immune-driven disorders. I hate saying autoimmune disorders because that sounds like a defeatist attitude, like your immune system woke up one day and just decided it wanted to destroy you. That's a hard thing to come back from. But we talked about these inflammatory ways to take a look and evaluate your system for chronic low-grade inflammation. As you said, some of the things that we might look at on traditional blood work, we might be further down that line to see those inflammatory markers elevated. And then I think the way to finish is that we're going to see, you've got this presentation coming out. And if somebody wants to get maybe more in-depth understanding of how inflammation is impacting their health, their lack of health, their quality of life, their chronic illnesses, whether it's an autoimmune condition or just some other chronic illness condition, including, in my opinion, obesity. I think we blame obesity for creating the inflammation, and it does, but you had to have dysfunction in many cases to get to the obesity part to begin with. So I appreciate you coming on, having the discussion. We'll probably need to have you come back at some point and maybe just cover one topic, like toxins and how they may create problems and the different ways to test for them and what significance of maybe the different ways to test for them. But tell people one more time where they can learn more about the presentation, what it is, and when it's going to be out, and how they can join it.
Thank you, Dr. Eric. Thank you so much for the opportunity. It's the inflammationequation.com/Eric, ERIC. You can register now. Fran's interview is there. It gives you lots of thoughts, lots to think about, and we'll look forward to seeing you there. Dr.
Awesome.
Eric, thank you so much for the opportunity.
Thank you.